Rotate the legs towards me. That lifts the hips up, creates a little stretch. Oh, I just fell off. Yes, some lumps and bumps working through. And does that feel different to you?
Yes.
Feels like a bit more of a stretch. So it's like a next level up to add that rotation in to the QL. Okay? Right. Once you've done all of that, it's all then down to your clinical treatment plan as to where you go next. Because you could just go down into the hips and glutes. Or if your problem is in the lower back and the QL, you might decide to actually go in and treat the QL more extensively. And so the next step would be to move into a side lie for me, Phil. So if you go into a side lie, keeping on this one. And so if we're keeping on this side, it needs to be up and presented to you so that you can work it better. This is what I want you to do first. Find the top of the ilium. Oh, hold on. This is what I want you to do first. Bring the top leg off the bottom leg, bring it into extension and drop it down towards the couch. Mm-hmm. The hip is now dropped in this position. With the top arm, take it up and reach over the top of your head. The rib cage is now lifted and moved away. So the space in the hips is increased. Okay, that's really important, those two moves. You could give him a cushion, but remember you're trying to create lateral flexion. No, it's fine, it's fine. You're trying to create that banana appearance that the QL would cause tightness in it. So in this position, we are stretching the QL out really nicely, and we're giving ourselves space to work. Comes down to your palpatory skills. Just going to do a little marker for you, Phil, sorry. So, find the top of the ilium. Have a little palpation. It's tricky on Phil because there's a lump right there. I feel like, is that a rib or is that a lump? What's that? But there's the last rib there. So you could mark out those two areas. There we go. If you join your fingers or go right to the middle, that is where your first trigger point is. Right in the center. So your direction of pressure should be coming away from the rib and into the center of the QL. Okay, trigger point number 1. Trigger point number 2 is on the ilium and on the ilium. Trigger point number 3 in there and there. So I always treat the center first, then I change my direction and come onto the top of the ilium, and I would just have a feel of whether the anterior portion of the hip of the QL is tight as well. Most of the time it's around the back that you get that tightness. Okay. Oh, sorry, Jack. Here again. So, okay. So we've done a little bit of a warm up already. We've massaged it, we've warmed it up. So now we can go in and we can go into the deeper techniques. We've got, it's not, you could go into your flow up the sides, go back to your level 3 stuff. Remember all the stuff that we did in the side lie position, so going up or going down would work, but for me it becomes more of a therapy, and I'm now wanting to get in and treat those muscles. So we're going to go into the QL for side lie position. Because it goes to the ribs and down to the hip, encourage breathing the whole time. When I apply my pressure on, like Phil winced and he held his breath. So as you start to go into that deep muscle, talk about what you're going to do. This is going to get a little bit sore, so I just want you to take nice deep breaths. We're going to slowly progress into the QL, and just let me know when it gets to 6, 7 out of 10. That there already?
Yeah.
Lovely. Okay. 10-second pressure test. Deep breathing. Deep breathing is creating an unofficial soft tissue release because the ribs are being lifted, so the muscles are being elongated under your elbow. So the breathing is really helpful in treating this. And plus the deep breathing will aid in relaxation. So it's always deep breathing when it comes to the QL. Is that going down at all?
I want to lie and say yes, but no.
But no. So if it's moving, if you look on the board how it's kind of moving in an oblique fashion, the muscle fibers, really you could go up and down towards the hip, or you could come around the crest of the hip, across from back to front, or from superior to inferior, and just friction down through there. And that feels a little bit elevated, a little bit sore?
Yeah.
Good. Okay. So we started the process, we're getting a bit deeper. Now this might be a little bit intense for you because we've not really done a full-on treatment on you yet, but I'll let you guys do that now. So now we're going to create some soft tissue release. So we need to get the muscle into a shortened position and then lengthen it. Yeah. So to do that, you can progress your work. You could start with top knee on top of bottom knee, elbow down towards me. Now I've palpated and I've landmarked everything out. The distance now between the hips and the ribs is like right there is the middle, and the rib, and so you've got that much space with which to work. So you need to be a little bit careful. You could direct the pressure right down towards the hip, the ilium, and just ask your client to reach over the top of your head. So that lifts the rib cage and that lengthens the muscle. And can you feel that moving under your? Can you feel it moving a little bit? It's very light. It's not the most one, but that would be my first one if the QL was really tight and you're progressing this work. It's all done active. There's no passive or assisted. Okay, bring that arm down. The second way would be to keep that arm as it is up top, and then just moving the leg, bring it back, drop it off the couch, and then let it drop down towards the couch there. Good. So you feel that as soon as that knee slides over the top of the other knee, you'll feel that muscle tight and tense. I tend to go through like a